Здравствуйте, милые женщины, желающие осуществить свою мечту и стать мамой здесь, в одном из самых прекрасных уголков планеты Майами. Ваша мечта вполне реальна, и мы поможем вам в ее осуществлении. Наша компания Americanbaby2be предлагает целый перечень услуг, включая в себя не только сопровождение беременности и роды, но и проведение лечения, а также ряд медицинских процедур по искусственному осеменению и оплодотворению. Наша компания сотрудничает с самыми лучшими клиниками и докторами Южной Флориды, которые готовы оказать вам квалифицированную помощь. И сегодня мы находимся в офисе самой известной клиники Южной Флориды по репродуктивной медицине и бесплодию South Florida Institute of Reproductive Medicine. И мы хотим представить ведущего специалиста в этой области, профессора Dr.Ellen Wood. Hello, Dr. Wood. Could you please introduce yourself to our clients overseas?
Sure. Hi, my name is Dr. Ellen Wood, and I work here at the South Florida Institute for Reproductive Medicine. Our clinic has been a part of South Florida for the last 20 years, and I've been working here for the last 13, helping patients have babies.
Dr. Wood, can you please tell me why is your clinic is so special and why our clients have to choose your clinic?
Well, our clinic, the South Florida Institute, it's one of the most successful clinics in the United States. We have been consistently in the top 5% as far as success in all age categories for in vitro fertilization. These statistics are calculated by the CDC, the Center for Disease Control in the United States, and they're located on the internet in what we call a SART database. Okay, our statistics for the last 5 to 7 years have been top in the country in all age categories, specifically with egg donation, as well as for patients that are age 41 and 42. These statistics have been well known in South Florida, and our clinic is one of the largest in the area.
Doctor, can you please tell me what kind of infertility disease you treat? Especially, I know there is a big percentage of the women who suffer with endometriosis, and how can you help this type of women to conceive and become pregnant?
Well, endometriosis is definitely a common disease that we see in our practice. The best treatment for a patient with endometriosis is to move forward with in vitro fertilization. We have extremely high success rates, especially in patients under 35. Over 75% of them are getting pregnant when they have the disease of endometriosis and not able to conceive on their own. There are other conditions that are associated with endometriosis that we specifically and uniquely will evaluate patients for to improve the chances that their embryos that we create will implant. Besides endometriosis, there's other diseases that we specifically treat, such as male factor infertility. We also treat tubal factor infertility, and our success rates are exceedingly high in with all of these patients.
Doctor, could you please be kind enough to tell us a little bit about freezing eggs procedures?
The egg freezing procedure is new. It is an excellent way for patients to preserve their fertility. It is no longer considered experimental by the American Society of Reproductive Medicine, and we have been routinely freezing eggs for the last 4 to 5 years. It is an excellent option for patients who want to delay their childbearing. We are freezing all ages now, women in their 20s and 30s, and even some patients in their 40s if they want to delay their childbearing. It is a procedure called vitrification, and it usually does involve in vitro fertilization. We recommend some routine testing before undergoing the procedure to see if you're a good candidate for it, but the success rates have been exceedingly high. Over 1,000 babies have been born worldwide from frozen eggs, all healthy.
Doctor, can you talk a little bit about the new procedures that has been out there?
There's a couple new procedures that we've been doing. The first one is testing of the embryos prior to replacing them in the uterus. That's called PGS, or pre-implantation genetic screening. And what we can do is we can take a cell off of an embryo, either at the 8-cell stage of development or at the blastocyst stage of development. That cell then gets analyzed in the lab to see whether the baby is going to be normal or not. That screening will test for genetic disease as well as syndromes like Down syndrome. If the patient does not opt to get their embryos tested, there is newer blood testing that we are doing as early as 9 to 10 weeks pregnant in order to tell whether the baby could be at risk for Down syndrome. It is just one tube of blood. It's 99% accurate, and we are getting results back in 7 to 10 days. It's a neat, novel procedure, and it also allows you to know the sex of the baby at only 11 weeks pregnant.
Doctor, thank you so much for your time, and we are looking forward to work with you in the future, and for you to will be able to help our clients overseas to realize their dream to become a mommies.